Welcome to CEO Money. I'm Michael Yorba. Thanks for joining us. All right, my guest today is Jamie Koufman, Dr. Jamie Koufman. She's the founder and director of the Voice Institute of New York and clinical professor of the New York Eye and Ear Infirmary of Mount Sinai Medical System. Dr. Koufman, welcome to the show. Thanks for being here.
Thank you. It's my pleasure.
All right, let's get into some of the biggest. First, list the books that you've written. I know about them, but our audience may not have heard about them. I want you to bring those out, and then let's dive into how you're going to take the medical industry and just turn it on its ear.
Well, first of all, I should tell you that I started out as a laryngologist. That's a branch of ENT. I took care of people with voice disorders, and I had one of the first lasers in the United States in 1978. And because of that, I kept seeing this pattern of complications and inflammation I didn't understand. And I said, I think these people have acid reflux. And so we began investigating this seriously in 1983. So my career has been spent looking at the effects of acid reflux that come all the way up into the throat. And so they cause voice problems, they cause sinusitis that isn't sinusitis, allergies that aren't allergy, asthma that isn't asthma, and a whole host of problems. And I would argue that 70% of respiratory diseases are actually silent reflux, meaning silent, they don't have heartburn or indigestion. So the problem is that reflux is a microcosm of what's wrong with healthcare. And really, you can, for listeners who don't know, American healthcare is last among all developed countries in terms of all of the important metrics in terms of quality of care. And yet we cost 4 to 8 times more. We spend $10,000 per every man, woman, and child in America to get lousy care. And so the question is, what's wrong? So the first problem is the food. So when I grew up, we didn't have obese people. Nobody had asthma, hardly. There was no sleep apnea or esophageal cancer. Coronary artery disease wasn't so common. And all of these diseases are the same epidemic. So where the Western diet goes, obesity, diabetes, cancer, reflux, and all these diseases follow. So Americans, like other Homo sapiens, like fat and sugar and salt, and that's what the industry figured out should be our diet. So when you see that double cheeseburger with the bacon on it, with a Coke and a big thing of fries, it ought to have a warning on it saying, this product causes death. So we've come to a diet that causes most of our chronic diseases, and doctors are trained nothing about it. So let's get back to the question of reflux. The first book that I wrote in 2010 is called Dropping Acid, the Reflux Diet Cookbook and Cure. And we figured out that in 1973, the FDA said you have to put a little acid in everything in a bottle or a can crossing state lines to kill bacteria. And so, but the FDA never dreamed that what we would do indeed is put the same amount of acid as is in stomach acid. So when you drink a soda pop or an orange juice or anything, you're drinking stomach acid. And sometimes they don't tell you it's acid. It may say, all natural, all organic, coconut water plus vitamin C added. And vitamin C, of course, is ascorbic acid. So we figured out that there was a huge amount of acidity in everything we drink except for still water. And that's why the book was called Dropping Acid. And it was the first book that said reflux is not a chronic disease. If you change your ways, if you don't eat too late, you don't drink too much, and you don't have too acidic or high fat a diet, you can make reflux go away, including respiratory reflux, which means, quick anecdote, a woman comes to see me, 7-year-old child she wants to talk about, has asthma. I ask her about her child. Every night the child gets ice cream and chocolate milk before bed. And I said to her, listen, you're my patient, but why don't you just stop giving your child any bedtime snack whatsoever, which she did, and the asthma went away. So my background is in reflux. First came Dropping Acid, and then I wrote a book called The Chronic Cough Enigma, which is important because chronic cough is a very common problem, and there's actually no other content out there. except for this book on the internet. And then comes Dr. Koufman's Acid Reflux Diet, which was written to try to explain more about the transition from the detox diet, which is 2 weeks. And people wanted gluten-free, and people wanted a vegetarian recipe. So they're included. And then finally, we wrote this book, Acid Reflux in Children, because we were finding, I worked with 2 very prominent pediatric otolaryngologists, that the problem was even worse in children because none of them had heartburn. They have asthma, breathing problems, a cold that never goes away, and all of these different problems. So if you sort of take my summary of my experience, my patient population, my looking at numbers, I estimate that we spend about $200 billion a year to get reflux wrong.
Wow. Okay. That's just too big of a number to get it wrong. What are you doing to get it right?
Well, the first thing is that the gastroenterologists hijacked reflux. When the endoscopes were first marketed in 1975 by the Olympus Corporation, there were just a few starving gastroenterologists. And now, whatever that is, 2 generations later, we've spent $1 trillion, that's with a T, on the heartburn business model. And that means heartburn is reflux, reflux is heartburn, and it's about the esophagus. Unfortunately, treatment with proton pump inhibitors doesn't effectively treat reflux. It may alleviate some of the symptoms. So on the GI watch, esophageal cancer caused by reflux is the fastest growing cancer in America,
right?
Up 850%. So the purple pills, in 2014, out comes an article from Danish article, national study, long-term use of proton pump inhibitors is associated with an increased risk of esophageal cancer. So it was about the same time that I had already been, I was the #1 prescriber of proton pump inhibitors in the world for a decade. This was told to me by AstraZeneca. But we began to not use them anymore as the side effect profile began. And so we found out that we could reverse disease based upon diet and lifestyle. And I might add that people ask me all the time, Dr. Koufman, you live in New York, when you tell people to modify their diet and lifestyle, don't they just tell you to go to hell? And the answer is, I'm taking care of people who have life-threatening disease. They have sleep apnea, they're tired of their mask, they've got diabetes and obesity and chronic cough and voice problems and 15 other symptoms, and they're fixable. And so once I sort of began looking at this, I'm a fanatic in the sense that we began looking at the risk factors for reflux. So you asked me a question, which is, how do we spend $200 billion to get it wrong? And before I tell you how to get it right, I should tell you that most of the people who are having sinus surgery shouldn't have sinus surgery. They come back to me, unless you've had an acute upper respiratory infection and one-sided incredible pain, and the pain goes in your teeth, and there's pus in your nose, it's not sinusitis. So reflux can cause inflammation around the sinus openings, and so many people who are having sinus surgery don't need sinus surgery. Second thing, same thing with kids. They don't need so many ear tubes. They don't need so many tonsillectomies. And so a lot of the surgical stuff that's done, particularly in the nose, is probably unnecessary surgery if the root cause were identified. And then comes asthma. Asthma, we spend about $60 billion a year on asthma. And for listeners, you should know this because this is a hard fact. Asthma is when you have trouble getting the air out of the lung during exhalation. The thing is this, the bronchial tubes become swollen, so it's hard to get the air out. Anything other than expiratory wheezing is not asthma. So if you know someone who has asthma or a child who has asthma, ask them the question during the asthma attack, do you have more trouble getting the air in or out? And the answer is 4 to 5 people say in. So you say, well, what's wrong with the pulmonary doctors? Why don't the pulmonary doctors know this? Well, they don't examine the throat. They don't know what reflux looks like, and they defer to the gastroenterologist who sticks a tube down into the esophagus and stomach. That test doesn't tell you whether the patient has reflux. That patient tells you whether the patient has esophageal disease. But you can have 50 reflux episodes a day in your esophagus, and it's just fine. It's robust. The problem is when the reflux comes into the throat. Mm-hmm. So all of the manifestations, wake up in the morning with a whiskey voice, sensation of a lump in the throat, postnasal drip, too much throat mucus, chronic throat clearing. These are mucous membranes, and so they become irritated and they make more mucus. So what I'm saying is that the specialists have missed reflux, which is the most common disease in America by far. We're talking about half of the U.S. population, probably, if you include the children and the silent refluxers. And they run from specialist to specialist to specialist, where they get more expensive diagnostics and no effective treatment.
So your cure is diet and better examinations, or understanding the examinations better?
The answer is it gets more complicated than that. First of all, okay. If someone, I'm a larynx whisperer, if you will. So when I look in somebody's throat, I can tell whether they have reflux during the day, during the night, if they've had it for years, if the sinuses are affected. So this is not taught in medical schools yet. So I feel like a lone wolf, like how
about a pioneer?
A pioneer. It's like I'm dealing with still with a medical establishment that thinks the world is flat, and I'm saying, hey, it's round. But I think there's I wrote a piece in the New York Times last June called "The Stranglehold of Medical Specialists," and what we found out was that essentially, medicine being a zero-sum dollar game, the specialists control CMS, Medicare and Medicaid, which basically sets all fees. And so the poor primary care physicians, last I looked, the average primary care visit was 7 minutes and $17 reimbursement. So that's not enough. That's barely enough time to write a prescription or make a referral. So what I recommended is that Medicare take 10 or 20% off the top of all specialist reimbursement for everything. Let's not be selective. If we're going to have a tariff, it's going to be a real tariff.
Right.
And let's make sure that primary care physicians make about $250,000 a year. And let's let primary care physicians be real physicians with real training. And you'd have a doctor that would have your back, that you would trust, that you would come to know. All of the data from everywhere, all over the world, including data from this country, shows that if you have a primary care with real training, you will get better care at a far, far lower price. So we have the problem of too many specialists sending the patient from one to another. The specialist with the cough goes to the pulmonologist, the lungs look okay, goes to the ENT, maybe it's reflux, goes to the GI, doesn't find anything in the esophagus, goes to the allergist, and all of them get paid and all of them start some treatments, and hopefully most of them don't do things that are destructive or make the patients worse, but they do in many cases. They get steroids and antibiotics and all these things, and they get CT scans of the chest galore, when what they really have is reflux, and they need to stop. And by the way, Americans, particularly since 2008, I think, they don't eat much breakfast. They have a sandwich for lunch, and then they leave work at 6, and then they go work out, and then they have shopping and childcare, and they don't get home till 8 or 8:30, and then they go to a trough, and they eat until they're full, and they go lie on the sofa and watch the news, and they get up and they have some ice cream, and they go to bed and they reflux all night. So the highest, and if you eat alcohol, have alcohol with what you eat at that time of the evening, your chances are you're going to have reflux disease. So this is a paradigm shift, and I think that the take-home messages are, number one, proton pump inhibitors are dangerous. By the way, $15 billion a year industry. the arrogance of the big pharma. So they have little proton pumps in the stomach that make acid. You got proton pumps in your kidneys, you got proton pumps in your brain, and you got proton pumps in your heart. So what do we see? Kidney disease, heart disease, arrhythmias, depression. And so the idea that these could be given in large doses to 30 or 35 million people and still not effectively treat their reflux is amazing. So I think the idea of looking for, new pills or procedures for reflux is the wrong way to go. What's really happening, the real revolution, is in diet. If you watched 60 Minutes last night, you got a fisherman who wasn't making any money, who was struggling and not feeling good about his livelihood, who's now got a kelp farm, and under the kelp he's growing oysters and other things. And so this idea of a plant-based diet, all protein comes from plants. And so there are solutions that are very radical. And interestingly, most of your listeners are probably not millennials, but the millennials are going vegan by the million.
Yeah.
You know why? First of all, you save yourself. Second of all, you save the planet. I mean, the amount of feed that one cow gets would feed a village of children for a year.
Let alone the methane.
You say screw you to the evil corporations, and it's cheaper. And I've been vegan for a year and a half because I had my carotid arteries checked, and I didn't want to die of a stroke, which is what a lot of my family members do. And so sure enough, my arteries weren't looking great. So I went vegan. You can reverse coronary artery disease too. And I'm looking forward to getting my arteries rescanned, ultrasound scanned, this fall. And I expect to see some of that plaque gone. So there's a revolution occurring. The revolution ought to be in plants. The revolution ought to be in farming, which is not industrial. The whole idea that we need to drink milk, that we need to have beef, that we need to get protein from these kind of sources is nonsense. And if Dr. Colin Campbell wins the Nobel Prize, I've started a petition, Dr. Campbell 4, numeral 4, Nobel.org. And the first day we got 5,000 signatures. It just went up. It's going to create a paradigm shift. And so I think that the future is going to be in plants. The future is going to be in efficient use of space. I don't think hydroponic gardening, on a big scale is the way to go. But you're going to see many places. I have a farm in North Carolina, and we grow everything that I eat pretty much comes off my farm. It's 150 feet by 40 feet. So the answer is, when it comes to reflux is really about diet and lifestyle. It's a vicious cycle. The more you reflux, the worse the reflux defenses. The less you reflux, the more normal physiology is restored. And then I tell my patients, you can lead a horse to water, but you can't make him drink. And you can't have your cake and eat it too. So if your idea of a Saturday night is going out to a steak place at 8:30, having 2 scotches, a ribeye steak, a baked potato with a bunch of butter and sour cream, a chocolate dessert, and then a digestif, you got reflux. You're refluxing that night come hell or high water. And so we're seeing the change in New York. When I first used a famous restaurant I go to, a very famous chef, been going there since I first came. When I first went to New York, if I went there at 6 o'clock, the place was, dead as a tomb. And now if you go there at 6, it's full. And at 9:30 at night, the place is half empty. So I think they're starting to be trending in the direction of earlier eating as well. So that's sort of the story.
That's a good one.
The re-empowerment of the primary care physician is essential if healthcare is not going to go up and up and up and up. All these people are investing in new pills and procedures. And for example, there are a bunch of procedures that are supposed to fix reflux. None of them are any good, but they make a lot of money, and then 5 or 10 years later they come off the market. They're no good. You can have surgery. There's a real surgical procedure, but surgery alone doesn't stop reflux if you're still eating like a pig after you get home at night.
Jamie, we've got to call an end to it now. I know you've got patients waiting there at your office, but I want to thank you. And this is not your last interview with us. I want to bring you back so we can have ongoing conversations about case studies, things that have worked out for you, and your patients, so we can talk about their experiences and hear from the people that are changing their lives because they're following good advice that you're giving them.
The only other thing I want to say is, I'm in my prime at a relatively old age. It is my goal to help make healthcare in the United States better and cheaper. That's my goal.
Thanks for being a guest today.
Thank you. Bye-bye.
You're welcome. All right, you've been watching CEO Money with Michael Yorba. Thanks for joining with us. Don't forget to follow us on Facebook and subscribe to our YouTube channel. Thank you, and we'll be right back.